Malliotakis for 5 minutes.
Thank you, Mr. Chairman. Thank you all to the doctors for being here today and sharing your wisdom with us and giving us an update on what's happening. I wanted to talk about, just really with you, about some of the hypocrisy and double standards, though, we're seeing, because Dr. Fauci, you said it, your recommendations are consistent, but some of the policies that we're seeing coming out of either this administration or some of the leaders on the local and state levels really is a double standard. So, for example, I wanted to ask you your thoughts on the U.S.-Canada border remaining closed. Now, this is something that is having an economic impact, no non-essential travel. It's having an impact on families that want to vacation as well. And then we see the southern border being completely wide open. And I wanted to see if you thought that was an inconsistency and that we should be consistent moving forward, because this is a decision that's going to be revisited next week. So I wanted to know what your thoughts are on keeping the northern border closed.
Congresswoman, I'm not an expert on border controls, but it's very clear that the situation at the southern border is really profoundly different than the situation that I can see just as a private citizen looking at it, not as a medical person, but just looking at the need to get into the country from individuals who are coming from a variety of other countries using Mexico as a gateway to get in versus the situation in Canada. It's really clearly very, very different.
But they're citing public health as the reason to keep the northern border closed. So my question is, individuals flowing from 60 different countries, not being tested, perhaps bringing in variants, that should be, I think, a concern. And I would just recommend that we have some consistency in this policy moving forward. It's either a public health crisis or it's not, and that is just like one of the things I wanted to bring up today. And I think the other thing is, my colleague really made a good point in describing the situation at these facilities, and I was there along with him in this trip. And when you see how these facilities, COVID capacity of 250, you have 4,000 individuals, and then you come to New York City and you're telling, maybe not you, maybe it's our mayor, telling us that we cannot have kids in school 5 days a week. It's that type of double standard. The fact that these facilities could be at 900% capacity, but my local restaurants are at a 50% capacity, and they're struggling to keep their doors open. That's the type of inconsistency and the double standards that we're seeing from our leadership, whether that be national, state, or local. In my case, a lot of it is local. And the president did say he wants to open our schools within the first 100 days of his administration. That's approaching. That's approaching in the next week or two. And we still don't see that there's any plan, despite the fact that we gave the money in the December CARES package. The money was put in. The CDC had recommended, saying it was going to be a $28 billion estimated cost. They put in $64 billion. And the schools are still not open. New York has received $4 billion of that money. So I would just, since that you meet with the president regularly, I would just bring up some of these inconsistencies and double standards that we're seeing and say that if we want people to follow these rules and these guidelines, they need to be consistent and they need to be fair. Any comment, I would appreciate that.
On February 12th, we released our initial guidance in this administration on getting schools open. February 19th, we updated those guidance based on updated science. And for all levels of community transmission, the guidance recommends full in-person learning 5 days a week. There are some restrictions in high levels of transmission in high school students if they're not able to maintain 6 feet apart. But for the most part, this was a guidance and an operational plan to open schools.
Well, I hope you can share that with Mayor de Blasio. Thank you.
Gentleman, you back?
I'm done for this round. Thank you.
Thank you for yielding back. The chair